Most people never remember the tick bite. The ticks are tiny. When they bite, they're painless. Tick-borne illness are the ultimate great imitators. A single bite can transmit stealth infections that masquerade as depression, multiple sclerosis, chronic fatigue, or autoimmune diseases. Hi, I'm Dr. Gary Kaplan, founder and medical director of the Kaplan Center for Integrative Medicine. If your health has taken a sudden and terrifying shift, bringing on extreme fatigue, body aches, or severe mood changes, and nobody can tell you why, we need to have a talk about ticks. Tick-borne illness are the ultimate great imitators. A single bite can transmit stealth infections that masquerade as depression, multiple sclerosis, chronic fatigue, or autoimmune diseases. And here's the part that most people don't realize. Many of these cases are preventable if you know what to look for and what to do early. You're not lazy. You're not imagining this. Today, we're going to take a deep dive into post-treatment Lyme disease, how these infections hack your nervous system, how to protect yourself and your family, and the exact steps you need to take to finally get answers and heal. Lyme disease can manifest as multiple sclerosis, Alzheimer's, chronic fatigue syndrome, fibromyalgia, and a number of psychiatric conditions such as bipolar disease, obsessive compulsive disorder, major depressions, ADHD. Now, be clear, I'm not telling you that you've got multiple sclerosis because of Lyme disease. I'm telling you that you have Lyme disease in some cases and it gets misdiagnosed as multiple sclerosis, or it gets misdiagnosed as Alzheimer's. Lyme disease has essentially three stages: the early localized stage, the early disseminated stage, and a later stage or chronic form of the disease. And here's something crucial you need to keep in mind. Most people never remember the tick bite. The ticks are tiny. When they bite, they're painless. And they often attach in hidden areas, such as underneath your hairline or in your hair itself. They will drop off after they fed and go away, and you may not even have known they were there. So early prevention and detection matters so much. Prevention, and it's not complicated, but it has to be intentional. First, dress for the job you don't want. You don't want chronic Lyme disease. So, if you're going into wooded areas, tall grass, or even the backyard in high-risk regions, and we here in the metropolitan area of the District of Columbia all are in a high-risk region, you need to wear long sleeves and long pants. You need to choose light clothing so that you can see ticks if they're crawling on you. You need to tuck your pants into your socks. You need to tuck your shirt into your pants. That alone significantly reduces exposure. The other thing you can keep in mind is the use of right repellents. So DEET at 20 to 30% is kind of the gold standards. There's a couple of other alternatives. Picaridin, IR 3535, and oil of lemon, eucalyptus, also prevent ticks from getting on you because they don't like the smell. But what most people miss is this: your clothing matters just as much as your skin. Permethrin-treated clothing kills ticks on contact. You can buy this pre-treated gear or treat it yourself, but you don't want to get permethrin directly on your skin. You want to be aware of your environment. Ticks are hitchhikers. What they like to do is crawl out to the very end of tall grass and wait for some animal or person to come by, brush against it, and then they hop on. Also find them in leaf litters, and you also find them in the edge of wooded areas. So you want to be thoughtful. You're going to find them in your gardens also. So you want to be thoughtful and careful about the work that you're doing outdoors and just pay attention. You want to stay in the center of the trails. And of course, check your body. Within a few hours of being outdoors, do a full body tick check, especially on your kids. You want to look at the backs of the necks, the backs of the knees. You want to look in the groin area. You want to look in the armpits, the scalp, behind the ears, and the waistline, because ticks love to crawl into those areas and they'll feed. Ticks need a certain amount of time of attachment in order to transmit the infections. There's some debate about how long they need to be there, but if you find an engorged tick, they've been there more than long enough to create an infection on you. If you happen to find a tick on you, the best thing to do is you want to take it off with a pair of tweezers. You want to go down all the way where the head is, and you want to clamp it and try and lift it straight out and then clean the area. The other thing you want to do with the tick, as I said, is you want to put them in a small bag or container, and you want to send them to your county or state health department so they can analyze the bug. They will analyze the bug typically for free, and they'll tell you whether or not there are any infections. Lyme disease is a bit of a misnomer. They're tick-borne diseases, and there are multiple diseases that ticks can transfer. So ideally, it helps to remove ticks before they attach. Certainly makes them easier to find. When you're taking your clothes, you want to make sure that you put them on high heat for 15 to 20 minutes in the dryer. That will kill the ticks. Washing alone doesn't do it reliably. And finally, don't forget your pets. Dogs, outdoor animals can bring ticks into the home, and so use proper prevention and check them regularly. Also, dogs can get Lyme disease, so you want to make sure they're vaccinated. While we don't have a vaccination for us, there is a vaccination for your pets. The best protection is simple: repellent, protective clothing, and consistent tick checks. Simple. So first things first, let's prevent ever developing the problem. So now, even with prevention, exposure still happens. And that's where understanding symptoms becomes absolutely crucial. Because Lyme symptoms can include brain fog, panic attacks, memory loss, migrating pains, joint pain, joint swelling. The migratory pains in particular with Lyme disease is kind of a hallmark, because there's not a lot of diseases that cause migratory joint pain. Okay, not just muscle pain, but really we're talking about joint pain. So migratory joint pain is really very unique to Lyme disease. And then you can have problems when your brain is involved additionally with sleep disruptions. So there's a lot of things that can happen. And you can also get a number of neurologic disorders such as obsessive compulsive disorder, severe depression, anxiety, and neuroinflammation in general. So psychiatrists, for the most part, don't think of this, and all too often will diagnose a psychiatric condition that really is a medical condition. This is where we want to pay real attention. We have to be attentive to the fact that these infections can result in neuropsychiatric issues. All right? If the infection-driven symptoms are treated only with psychiatric medications, you miss the diagnosis, you miss the problem, and you are due for a world of hurt for a very long time. The medications may help temporarily, but they don't eliminate the infection, which as such, you'll have ongoing neuroinflammation and an ongoing dysregulated immune response. So we've got this ongoing inflammation going on, and the disease continues underneath the surface. That's why early detection after exposure can prevent years of misdiagnosis and decline. Give you an idea of how severe this can be. I had a young woman that I saw a number of years ago. Will not discuss her name because of HIPAA compliance, but she was a child at the time. She had developed severe OCD, hallucinations, violent outbursts, age regression, episodic paralysis, pseudoseizures. This is a classic PANS presentations, pediatric acute onset neuropsychiatric syndrome. There's a whole series of infections that can create PANS, and Lyme is one of them. Her family doctor and the psychiatrist both said this is a psychiatric problem because her standard blood testing was all normal. But advanced imaging revealed brain inflammation. Advanced testing found that she had Lyme disease, Bartonella, Babesia, as well as mold toxicity. So again, we need to be taking a really in-depth look at what's going on. Lyme disease is kind of the umbrella diagnosis, but the reality of the matter is there are multiple tick-borne diseases. You don't look, you don't find. And so it's very important that we do a thorough investigation anytime we know there's a tick-borne disease involved. If the disease had been caught earlier, could have saved a world of problems. Instead, what happened was it took years of recovery, even with proper treatment. Because once the brain gets inflamed, it takes a while for the brain to recover. The other part of the problem is once the immune system gets dysregulated, it takes a while for that to get properly set back again and recover. So the reality of the matter is this becomes a very long, complex problem. She did recover, however, She's doing spectacular. She'll be graduating from college this year. Testing is another major issue because there's really problems with the standard Lyme testing. Standard Lyme testing done by the conventional labs relies on antibodies. That means that your body has to have responded to the bug. If the bug's been in your body for a while, for one thing, these bugs are pretty good at immune evasion. And for another thing, it takes at least a week when you get bitten for the antibodies to start showing up. So you can do the testing too early, you'll miss the diagnosis. So plenty of people have been told, no, you don't have Lyme disease because the testing was done 24 hours, 48 hours after a known bite. That test is negative, but the reality of the matter is 2 weeks later, that test would have been positive. And the person, unfortunately, goes on to get progressively ill. But it's now on their record that they've been tested for Lyme disease and it was negative. So if you don't understand what the limitations of the testing is, you're going to miss the diagnosis. The ELISA test, the most common test, misses up to 30% of the cases. And honestly, the immunoblot testing that's done by the conventional labs misses almost as much as 50%. So you need somebody who understands Lyme disease, understands the testing, and understands the labs that are ideally suited for doing the best and most sensitive testing to diagnose Lyme disease and the other tick-borne infections. So as we said, ticks rarely transmit just a single disease. Many of them carry Bartonella and Babesia. Babesia in particular is a parasite. They'll also carry ehrlichiosis. They'll also carry anaplasma. So there's a number of different diseases that a tick can carry. Bartonella can cause severe anxiety. A lot of neurologic symptoms with Bartonella. Rage, depression, other neurologic problems such as migratory numbness or pains, neurologic distribution. Babesia, night sweats. And I'm talking not a little bit damp. You soak through your clothing. You have to get up and change your clothing once, twice, 3 times a night because the sweats are so heavy. A sense of air hunger. Your lungs check out fine. Your pulmonary function studies are fine, but you always have this sense of not quite being able to get enough air. Crushing fatigue is another thing that we can see with Babesia. So you have to know the different symptoms of these diseases, and you have to have a high enough index of suspicion to go look for them, and you have to know what testing to do, highest probability of getting the correct answer so we know what we need to treat. So chronic Lyme disease is something that, or post-treatment Lyme syndrome, is something that you have to be working with somebody who understands how to do this. While most patients recover, 10 to 30% or more may suffer with long-term debilitating fatigue, pain, and cognitive issues. Thus, it's frequently not that you're treating just the bug, and you need to make sure you've treated all of the bugs that are there, but you also frequently need to treat the immune system because the immune system has become dysregulated because of these infections. So you also need somebody who treats not just the bugs, but somebody who can be attentive to immune dysregulation, autoimmune processes that may have occurred in order to be able to help you recover. Lyme disease, chronic Lyme disease, can be completely disabling, and you can end up with severe headaches, fatigue, muscle aches, and misdiagnosis is not unusual. Kids have to drop out of school. Parents may have to drop out of work. And so we see this dramatically and severely impacting people's lives. The immune system's response to this bug is very interesting. What can happen with the immune system is that it overshoots. And so it becomes dysregulated, and through a process called molecular mimicry, your immune system starts turning on your own tissues, specifically your brain. And then what happens is you have an autoimmune encephalopathy, and what happens with this is brain fog, focus, concentration issues, headaches, severe crushing fatigue, sleep disturbances. So you can really get disabled from this. And the disability may be from the bug itself, or it may be from the way your immune system reacted to it. You need somebody who understands to look at the totality of this process and not simply see it as the infection itself. There's Cunningham, which is a test that looks for antibodies to certain parts of the brain. There's the Mayo Clinic antibody panel, which can also help give us more insight as to whether or not you're making antibodies to your own neurotissue. And then you need somebody who has expertise in understanding how to treat these conditions. And they can be treated with things such as intravenous immunoglobulins. They can be treated with therapeutic plasma exchange. Rituximab and Celsep are currently the therapies that we typically use in treating immune dysfunction associated with these diseases. Kill the bug first, but then you have to make sure the immune system itself is quieted down, because you may still be sick, because the problem is now your immune system that's gone rogue, even though the bugs are now gone. So comprehensive care is essential. Somebody who truly understands the true depth and breadth of what can make you sick and keep you sick. Treatment is complicated, but most commonly involves antibiotics, though you need to make sure you're getting the right antibiotics for the right disease. So if you're treating Lyme, it's one set of antibiotics. If you're treating Babesia, you actually need antiparasitics and anaplasma. So you have to know what you're treating. It's not just a matter of one size fits all. I will tell you, in our practice, if you get bit by a tick, we tend to treat aggressively because we don't want you to get sick. So before we know what was in the tick, we'll start you on an antibiotic. And we'll typically treat you for 2 weeks to a month, depending upon your history. But there's frequently people will treat for only 3 days. The data on that is horrible and should not be considered a treatment for prevention of Lyme or treatment of Lyme disease. So basically, you're going to need to be on antibiotics for a couple of weeks, or at least until we get the tick back and find out whether or not there are infections in it. So we treat early, we treat aggressively, because we've seen how devastating this disease can be if it's allowed to persist into its chronic form. But prevention should be a consistent, ongoing thing whenever you're outdoors. If there's one thing I want you to take home and remember, it's this. Tick-borne illness is common, it's often missed, but in many cases it is preventable. It's extremely important to prevent the possibility of getting any ticks, as tick-borne illness can open you to a much larger, higher risk of developing other chronic health problems. It can ruin your life. So we want to do everything possible to prevent you from getting Lyme disease and other tick-borne diseases. If your health changed suddenly and no one can explain why, don't ignore the possibility that what's been missed is Lyme disease. You're not imagining this. You're not alone. And with the right approach, there is a path forward. So let me run through a couple of questions that we get online. One question asks whether or not the disease can make you allergic to meat after a tick bite. The answer to the question is absolutely yes, but it's from the Lone Star tick, and it's called alpha-gal syndrome. So if you find yourself getting deathly ill after eating red meat, this may be a problem. You need to be tested for it. And unfortunately, it may mean you're not eating red meat again. So question asked, how do I check for tick bites? We've gone through that. Look everywhere throughout your entire body, and also make sure as you're working outdoors that if you see any ticks that you spray the area in order to kill them. There are some plants you can plant in your garden that'll help keep the ticks away. You'll find those online. Should I keep the tick? As we discussed, yep. If you find the tick, keep it, put it into a baggie and ship it off to your county medical board and let them analyze the tick. There are other services if that's not available, if you go online, but typically that's the best place to get it done. Is there a vaccine or pill to prevent tick-borne diseases? There are not. Prevention is behavioral, repellent, clothing, and tech checks. What ticks are in the DMV area? Basically the black-legged ticks, the Lone Star ticks, and the American dog ticks. The black-legged ticks are the ones that typically carry Lyme disease. Highest risk period right now, late spring all the way through early fall. But prevention should be a consistent, ongoing thing whenever you're outdoors. If you enjoyed our content, please don't forget to like this video and subscribe to our channel. You can learn more about our services at kaplanclinic.com. Take care, and I'll look forward to meeting with you next time.